Hi everyone, this is Josie from OPWDD. I just wanted to go over a few housekeeping things before we begin. Today we are offering American Sign Language Interpreting. If this is a service you would like to use, you need to find the thumbnail in the top of the interpreters. We have two of them. They're listed ASL Interpreter and then their name, and you would want to pin them to your screen. They will be taking turns. We also are offering closed captioning. Today for closed captioning, it's in the bottom right-hand corner of your screen. If you click on Show Hide Header, it's going to bring up a list of options. You can scroll to the left and the right of the options. You can pick the font, the size, and the color that best suits you. You can also choose what language you'd like. Today we do offer this closed captioning in English, Spanish, and simplified Chinese. So you can set that. You can also increase and decrease the size of the window so that you can see more or less text at a time. And I think that does it for me.
Thanks very much, Josie. Roger Bearden, Executive Deputy Commissioner at OPWDD, welcoming the FSS committee and those who are observing this meeting to our quarterly meeting of the Family Support Services Committee. I wanted to start by kicking it over to Margaret Puddington, who is the chair of the FSS committee. Margaret? You are muted still, Margaret, unfortunately.
Good morning / afternoon, everybody. It's good to be back with everybody after so many months. It seems like such a long time. Thank you to Roger and Commissioner Kastner for including our recommendations for the commissioner update. We look forward to that. And I think we have someone taking minutes. Roger, do we?
Roger, I can address that. Margaret, we do not. I think we addressed this at the last meeting where we noted that there was a recording and transcript being provided for folks to be able to utilize.
That's true. But we did reply, the committee did reply that we found it necessary to also have minutes because not everybody's going to sit and go through all of the 2 hours of the meeting. And you need to have something that you can report. We always used to have minutes when there was a liaison, Family Support Services liaison, and we were hoping that we could renew that now. And I thought we had administrative support for that.
We don't at times, but we will be providing the transcript and we can revisit that for the next quarterly meeting, which is not something that we have available at this point, but can we?
Okay, very good. So we have now our first commissioner update in a while. So Commissioner Kastner, will you join us?
Sure, nice to see you all again. Let me just begin by talking about COVID, which is what we talk about all the time. As you know, we began our vaccination program in December and it's continuing. The vaccination program has been very, very effective at reducing both transmission and serious morbidity and mortality in the individuals who've received the vaccine. So where we have very high vaccination rates, particularly in our group homes, we've seen significant decreases in transmission. If you follow the data, which is now available online, you probably see that we're averaging between 10 and 20 new cases across our entire system of 128,000 individuals per week. And we're also seeing approximately 1 or 2 deaths per month. There's been a slight change in the pattern of transmission and infection. In the first and second waves prior to vaccination, we were seeing the predominant number of new cases occurring in residential settings. That has changed to right now we're seeing about half the cases in our residential settings, but the other half in the general population. and that reflects the fact that we have differential rates of vaccine uptake across our system. We're averaging about 85–90% in our residential settings, individuals receiving vaccination. Staff in residential settings has been lagging, and they're about 35–40%. In late February, we began prioritizing individuals living in the community, not in congregate settings, and their staff. And those two groups are also lagging. They're around 35–40%. So we are working with our stakeholders to promote vaccination. We're trying to ensure that every person we support has access to the vaccine and that our programs continue to operate safely. At the current time, people living with their families can receive vaccination by working with their care managers to schedule an appointment. You can also receive a vaccine from a pharmacy, a state-run site, a local health department, or pop-up clinics. There really isn't a difficulty now in individuals or their staff accessing the vaccine. As you're aware, the CDC has continued to adjust its recommendations for safety precautions, particularly around social distancing and face covering. We are reviewing those documents and updating them as is indicated. On May 17th, we issued 5 updated guidance documents which adjusted practices in light of the fact that a greater proportion of our individuals in residential settings had been vaccinated. And these documents related to visitation, community outings, in-person day program services, staffing, and return to work. Those are all listed on our website. They did not make any changes to the social distancing or masking requirements within day programs. That is still an area that's yet to be developed and finalized. For individuals who've been fully vaccinated, we are currently stating that they should not be prohibited from visiting on or off site as a result of exposure to COVID-19, so long as they do not develop symptoms. Fully vaccinated means you've received the final dose and waited for a period of 2 weeks after that final dose. Even if you're allowed to visit or go off-site, providers still have to follow the core principles of infection control and prevention, which are defined in the guidance. The guidance on May 17th also indicated that unvaccinated individuals may not participate in community outings if any individual or staff member working in the home is suspected or confirmed positive for COVID-19. So again, just to restate it, for individuals who are not immunized, we will continue to implement quarantine and isolation procedures to protect that individual and other individuals who may come in contact with that individual. Staff who've been fully vaccinated against COVID-19 did not need to quarantine or furlough after exposure, so long as they remain asymptomatic. As you're aware, this is all evolving. There are new CDC guidelines that are being developed. There are new statements that are being made by the governor, which are forward-looking. We will be incorporating both CDC and New York State Department of Health guidelines as we move forward in looking at our current guideline portfolio. As a quick waiver update, you're probably aware that we did receive an extension for our Appendix K. We received that in April. That means that we can continue to use the emergency flexibilities for up to 6 months after the end of the public health emergency. The flexibilities included the day program billing procedures, which allowed for providers to bill for a half day of service after delivering 1 hour of service. And it also allowed the day program providers to bill for a full day of service after delivering 2 hours of service. Those flexibilities were retroactive to October 15th and will continue until the end of the 6 months after the end of the public health emergency, or if we decide to take additional action. We held a webinar on March 12th to update the community about those flexibilities. I think everyone should be aware of them at this point. You're probably also aware that we've submitted an application to CMS for a waiver amendment that would implement some of these flexibilities on a permanent basis. We're calling this the permanent waiver. It implements changes to the day programs, pre-voc, respite, pathway to employment, support brokerage, and ComHab and SEMP. The amendment will allow service providers to continue to deliver ComHab in residential settings, what we now call ComHab-R. We will also be able to continue to use the telemodalities for the delivery of ComHab and respite. The amendment also included a mechanism for billing for crisis services, formerly what were called START services, but are now being called crisis services for individuals with IDD or CSIDD. The respite center component will now be funded through the waiver, and that'll give us an enhanced federal match, which will be useful to us. We've collected public comments in November and December of last year. We submitted the waiver in the spring. We expect to hear from CMS at some point in the near future with an implementation date of July 1st, 2021. We've been talking a lot about, well, let me just go on one other thing. A state plan amendment had to be submitted to address our state plan services. You're probably aware that the ICF program is not a waiver program. It's a state plan program. So a separate application had to be submitted to the feds to implement changes which operate in parallel to what we did with the waiver. So at this point, the ICF providers will be able to receive the supplemental payments that we provided to our regular day program, our group home and other waiver providers. We held a webinar on May 28th for our community to help understand how those could be implemented by ICFs, and that would be available on the website shortly. Going back to the issue of housing strategies, we will be working with our stakeholders through the summer and the fall to look at how we can improve the quality of housing supports and services. This would include a change in the reimbursement mechanism from a cost-based methodology to one based on the acuity of individuals. We will also try to help create support for moving individuals to an appropriate housing level, what we've talked about in terms of a flow initiative, and also expanding the use of supportive services into a broader range of areas. Things that are kind of sometimes in the margins, recreational cannabis. The state did legalize recreational marijuana, and we are now reviewing policies that we need to change and to update in order to accommodate the new law within our service system. We're also working with provider agencies to identify issues of concern and develop the necessary guidance for the impact of the legalization on our broader system. And then finally, the residential flow issue. We are working to create an initiative to help support individuals to return to the state, which will allow us to identify vacancies within state-operated residential programs that can be available to support young adults who are returning from inappropriate settings and then integrate them into our state. We will also seek to identify people who are currently within those state programs and assist with moving them to a nonprofit agency if they so desire. We are now working with nonprofits who have a history of providing a service to those individuals. So for example, if an individual is in a day program operated by a voluntary provider, but in a state-operated residential setting, we are looking to discuss with the voluntary provider whether they might want to be taking that individual on for both the residential and day program services. So we're currently looking at that. And then the last two items, the American Rescue Plan and the 507 Plan, you're going to hear more about that later. But just to bring you, briefly update you, The American Rescue Plan enacted by Congress provides states with a temporary 10% increase in federal matching share, known as FMAP, or Federal Medical Assistance Percentage. And that enhancement is in place for a 12-month period beginning April 1st through March 31st and affects the billings that are generated during that period. The aim of the program is to enhance, expand, or strengthen the home and community-based waiver. These are one-time funds that can be used to initiate projects or operations. They are not meant to supplant or replace existing funding. According to the federal documents, we have 3 years beginning April 1st to expend those funds. We are working within the state as part of a larger approach to the enhanced FMAP, coordinating with the Department of Health and all of the other Medicaid providers that generate the FMAP to create a comprehensive document, which would then be used to submit to the feds for New York State's plan. We are also at the same time undertaking our 507 process planning for this year. The 507 plan, as you know, is the comprehensive plan for the agency that is to be developed and guide us for a period of 5 years. This is consistent with the state mental hygiene law, section 507, that requires the plan to be updated annually. We will be sharing data with local government units, getting input from stakeholders, and issuing the plan later this year. I'm not going to go through the details because I think we're going to have a presentation on that later today. So let me stop at this point and see if there are any questions, and then we can move on to the agenda.
Commissioner, could you just explain to people on the conference about where the data is located, the COVID incidents and vaccination data is located on the website?
I know that our data related to transmissions and deaths is on the website. I don't know the specific link. We can provide that to you if you want.
Yeah, but it's on the COVID page and you just scroll down, right?
I believe
Get
so.
the data.
Yeah.
Yeah.
If
People
you
may
type
not
in
know.
OPWDD COVID data, which is usually what I do, it takes you, the browser will take you right there.
Great. Thank you. Thank you for the update.
Sure.
So I have a question, Roger. This, sorry, I'm losing words here. The transcription that's appearing on the screen seems to be very high quality. Is there a way that we could preserve it and share it? That would help help us to kind of cull minutes.
I believe so. That's exactly what we would be providing you.
Okay, so but then we could have it right away, right?
Yeah,
Would be helpful.
I can't guarantee exactly when it's available, but I think it's usually available to us within 24 hours or 48 hours, something like that.
All right, so let us work with that this time. Thank you.
This is Ann
Josie,
Sheriff. I have
we
a
do get a
question.
copy of the transcript. It takes about a week to get the copy of the transcript. Once we get the transcript, we do send it out to be translated into different languages. That can sometimes take a little time.
Okay.
This is Ann Sheriff. I have a question for the commissioner. In regards to the flow problems, I know that they're coming from out-of-state residential schools, and I don't know if there's a concentration of people that are coming back from a location within the state, and how will it kind of be spread around the state if they're willing to go to different parts of the state and coming back?
We're trying to locate the return in an area that would be geographically accessible to the families. It's not just a willy-nilly kind of throwing them out there, but to take into account that the families may want to visit and therefore look for a site that might be accessible to them.
Thank you.
Any other questions? I'll just add one more thing. We recently, last week, completed the Senate testimony on COVID, and I know that many of you either participated or watched. And I made reference to a set of statistics that I think were really important in trying to help us understand the effectiveness of our response to COVID. I think a lot of folks compare the experience that we have in our congregate care settings to that of the general population of the state of New York. And as I've commented, and I'll continue to say, I'm not sure that that's a reasonable or fair comparison. Congregate care settings have higher risks associated with the way that they're staffed and operate that lead to higher rates of transmission. And that if folks are comparing the performance of the IDD system to that of the general population, it's probably better to look at the experience of the 128,000 people who we serve across the entire state. And when you do that, and you look at transmission rates across both the general population and the general IDD population, you find that the transmission rate is actually about 5% lower for the general IDD population than it is for the general population. And I felt that that was a really important statistic to share during the COVID testimony, and I wanted to bring that to your attention today, because that outcome reflects the input of thousands and thousands of people, the individuals who were subjected to quarantine and isolation, who were not allowed to leave their group homes, who weren't allowed to receive family visits, to the family members who had to sacrifice, to self-direction and self-advocates, to our providers. Really, it touched upon everything that we do and everything that we've tried to do in the last year in particular. But the proof is that it worked, that we were able to reduce transmission below that was seen in the general population. And I think we saved hundreds of lives as a result. And I want to thank all of you for your work over the last year and a half in addressing and responding to COVID. I don't think anyone's time was wasted. I don't think anyone's effort was for naught. We have really great data and a great outcome. So, as much as it could be great, I want to thank you for all that you've done to try to help us in the last year and a quarter.
Great. Hi, this is Deborah, Commissioner. On behalf of the Brooklyn DD Council and the Brooklyn Advisory, we want to thank you for having Craig and Delia at our last meeting. They gave us a lot of updates. So they just asked me to thank you and the whole staff of the state for letting them present at our meeting. Thank you.
Thank you.
So I think what we wanted to do next on the agenda was go to our to the follow-up on the programmatic recommendations that the committee made previously to OPWDD. There were a couple of outstanding things we wanted to consult with you on. First was the contract, the FSS contract money that had been frozen or withdrawn. Has that been addressed, Roger? I don't want to go into the details because it is region specific, but just to
yeah, let me throw that over to Kevin. I think.
So Roger,
Yeah, I'm sorry.
I'm actually going to take the lead on that, and then I'll pivot to Kevin.
Thanks,
or Kevin
thanks Aviva.
Thank you, Roger. So Margaret and folks, just from a programmatic perspective, I think you all know that had providers turn in their contracts, and there have been some monies that have obviously been pulled back because of underperforming providers, et cetera. We didn't believe that it would be prudent to issue an RFP in the middle of a pandemic. I think folks know through some of our other updates that we are continuing to assess not only provider capacity, but really look at the landscape of services that are being provided to individuals. we recognize that what people's needs are today is very different than what that was prior to the pandemic. So I think we need to have a better understanding of the services and supports that people need before, and certainly have a better understanding of provider capacity before we issue an RFP. I think many folks have heard some of the challenges providers have outlined with regards to staffing. So we have been in contact with a number of our providers, assessing their staffing capacity, reviewing their ability to reopen programs. And I think in the next coming months, we will be in a place where, you know, with some additional information and certainly through feedback from the councils, through the FSS coordinators in terms of your landscape regionally, we would be incorporating that feedback and looking at whether or not RFPs need to be issued for the monies that were not previously allocated. And Kevin, if you want to add to that, please feel free to do so.
Yeah, no, thank you, Abiba. I think that, you know, sums it up. I mean, I think also with the, you know, 507, you know, planning process and, you know, what we're looking to do with the FMAP monies as well, you know, some of those types of arrangements could be overlapping. And just want to make sure that we've got, as Abiba said, you know, that kind of provider viability capacity to deliver the services, but also, you know, that they're, you know, consistent with, you know, those identified gaps as well that'll be identified through those processes.
That makes sense. Do any members have questions about that? I think it was Westchester and Sunmount who had raised the issue. No? Okay. So we had also requested that the front door staff, this is not exactly programmatic, but it's simple. The front door staff distribute information about the Family Support Advisory Councils. Has anything to do with that been implemented?
Margaret, I can address that. So we had conversations, and I believe the councils were going to send forward material to the coordinators to review. We really want to make sure that we have as much as we can have a uniform sort of document so that everybody's sharing the same information about the family support services programs and the specific councils. I don't believe that we've received that. So if the statewide council reps can send that directly to Nick, we would then coordinate with our regional office front door staff to look at including information specific to the councils at the information sessions, which I think folks know that are, you know, currently occurring virtually.
So you want members to ask their councils to send them their materials to Nick? Is that it?
So, yeah, when we previously discussed, Margaret, I'm not sure if it was you or members of the statewide committee that noted that you would be providing materials, the materials provided from the councils. We haven't received that. So if that can be sent to Nick, we just want to take a look at the material and try to make sure that we have, you know, a uniform document that can be delivering the same message across the board about the various councils.
Okay. Okay, so would the members please follow up with that? Contact your local councils and ask them to send materials to Nick. Yes.
Margaret, this is Maria Suchi-Kozak. I'm sorry, I tried to answer in the previous discussion about the RFPs. Can you hear me now?
Yes.
Okay, so if we may just go back for a second, because for some reason I couldn't unmute myself. I was the one who raised the issue about the $500,000 in Westchester. So we've discussed it many times, including with the people who are on this panel, as well as OPWDD staff. I understand what is being said to us now, that post-pandemic, we need to take another look at the situation. And I certainly agree with that. But I do want to also call everybody's attention to the fact that the needs that were there prior to the pandemic, which this money was designed to address, because we had worked on the RFP for close to 2 years. and the money was promised to certain agencies pre-pandemic, and it was a year later that the money was pulled back, at least half of it, half of the $500,000. And the point to that is the needs in the community have not diminished. The needs have been amplified by the pandemic. So one can relatively safely make the assumption that the needs that we had for crisis, which is what the money targeted, most of it still continues. Now, whether it needs to be redistributed, of course, that's a possibility. But to wait another 2 or 3 years before you guys decide to, send money or redistribute it seems unfair to the individuals that are currently suffering because they've lost so many services. So thank you for listening, and I appreciate your attention to this matter.
Sure. And Maria, this is Abiba. And just to clarify, we did not pull back money. The awards were rescinded. So the programs had not even been implemented. But I certainly recognize the concerns that you note. And we are working as quickly as we can on this end to really understand that specific need and capacity and provider viability so that we can ensure that the needed supports are available to individuals.
Right. So thank you for clarifying the terminology, because that's exactly what I meant, but obviously used wrong terminology. We never did receive the money. But the programs were notified that they were going to have the money to run certain programs. And I appreciate that you're going to take another look at it. I guess what we'd like to know is some kind of timeline and what it is that that you need from us in order to make sure that the look is consistent and merits everybody's needs across the board from the family's perspective.
Sure. I mean, I think probably by the next quarterly meeting, we can provide an update. But I think, the council's role is really to identify local need, right? And make sure that that's communicated to the coordinators and ultimately to the regional office director. So to the extent that, councils are hearing directly from families about specific programs and gaps, that's the information that we want to have. We've heard specifically from some providers that programs that they were offering are no longer meeting need. And we've had some essentially, turn in their contracts, right? So I think we need to take a look at this holistically and really make sure that if we're issuing an RFP, we're issuing an RFP that will be providing services that are meeting needs for individuals locally. So if you all can provide that feedback to the coordinators and ultimately to the directors, it would help us obviously to review that. And then obviously there's the 507 planning process that folks will talk about, which is an additional avenue for feedback in this area.
Thank you.
You're welcome.
Deb Gray has her hand up.
Abiba, when the front door came in, we were told to, we gave in our information, the advisory council, and ever since, all 4 years, we do the front door, the information advisory council is and the website is been given to families who go to the front door. We've been doing this ever since it happened, and we've always communicated with the councils, the statewide, that we've done this. But just so you know, we have been doing it.
Yeah, Deb.
Parents have been
Deb, I'm
pleased about it.
Yeah, I'm aware of that. It's just not happening across the board, and I think that's why the statewide council recommended more specifically that all of the councils provide information to the ROs to include in the information sessions. I'm aware that it's happening in some districts, but it's not happening consistently across the state. And I think that's what we're trying to address.
Okay, Beaver, I agree with that, but at the same time, I'd like to make sure that the reverses, it's not just us giving you the information, but is are those ROs across the state asking the advisory council for the information. It's two ways. You can't because I know other families, I know they've been given, and I'm not going to start naming names, but we have to, you'll have to make sure that they've been working with the advisory council across the state, and have they been working with them to give out the information. That can happen too, and then you can't say we're not doing it, we are.
Yeah, Deb, I apologize. I was having a hard time hearing your audio, but there's two specific responsibility right here, right? The local council has a responsibility through your meetings to make sure that individuals and families have information. You're supposed to be doing community outreach and engaging and making sure that any members who want to participate in the local councils certainly have that information and can do so. I think what the statewide committee was asking OPWDD to do was to sort of broaden that outreach and also share information with new families coming into the delivery system at our information session. And, we're certainly open to that, but we just want to make sure that we have the accurate information from each of the councils and can incorporate that into our sessions.
Okay, in case you didn't hear, fine, no problem. But what I'm saying is, I feel it's the responsibility of both the local, as not just the advisory, but also the local DDROs. You need to be working also with the advisory councils too, especially during this COVID time. And that's what I said, in case you didn't hear, because my audio went in and out.
Thank you, Deb.
The next recommendation was to continue virtual services, such as for training, advocacy, support groups, and peer-to-peer supports when they are needed and preferred. We had requested the ability of families to be able to choose remote or in-person services going forward after the pandemic.
Margaret, if that's related to the specific services, I think we noted previously that there's some work that's being done on the use of remote technology and the use of telehealth for certain services. And that guidance will be forthcoming. We really, again, want to make sure that the use of telehealth is certainly appropriate for the individual, and it's the individual's choice, and it's the right environment, et cetera. And so once we have more details on that, we would be sharing that information with folks. But again, want to make sure that when folks are using telehealth or remote technology, that they're certainly doing so because it benefits the individual. So we can provide additional updates at a future meeting, but thank you for clarifying, because I wasn't sure if you were talking about the regional meetings or if you were talking about the services specific to the contract.
The services themselves, yes.
Understood.
Okay, thank you. What is the progress with the family support reimbursement, family reimbursement guidelines? I know it's been in the works for quite a while.
Yep, so we are close to a final draft, and that final draft would have some internal review, and then we would be sharing that with a subset of the statewide council to review, as well as we've done previously. I don't have an exact update at this moment, but certainly I think we should be able to have folks ready to preview that before the next quarterly meeting.
Oh, okay, good. Okay. And then the delays in the approval of self-direction budgets, it appears that the problem is at the central office level and not at the regional level. Central office level appears to not have enough staff to expedite the reviews in a timely manner. And there's also an issue of, and I'm not familiar with this myself. I'm just repeating what I've been told here. So I hope I get it correct. If not, someone will let me know. If the central office finds a mistake, they delete the entire budget and don't notify the DDRO or the FI agency. So those are the issues that have been identified.
Yeah, Margaret, I'm not sure who, oh, I'm sorry, go ahead. Did I interrupt someone? I'm not sure who raised that issue specifically. I know that when we've been notified locally about, budgets that have been delayed, et cetera, we track that and take a look at what the issues and concerns are. I think everybody knows that when it comes to the budgets and amendments to the budgets, there's multiple steps, right? And I think sometimes there's delays that occur at each step, and sometimes those budgets need to be kicked back. So if folks have specific information on budgets that have been delayed and can send that forward, we certainly will look at it. But I'm not sure about, you know, your comments about deletions and kicking that back to the regional office.
All right, so as far as, I'm sorry, go ahead. I'm sorry, Aviva, go ahead.
I'm sorry, I thought Gail wanted to add a comment, but maybe not.
I did. I wanted to say that was actually the specific information that we were bringing to you, was that this is a practice that we've been made aware of that's impacting families and DDROs. So that's why we wanted to bring that to your attention. That was very specific.
So I guess my request for the specificity would be on specific budgets. Again, I know that there have been a couple of issues, right? We've had issues with, you know, FI contracts. We've also had issues with budget amendments, right? And those are two separate and distinct issues.
Yeah,
so
that's different than this.
Right, specific to the budget amendment, multiple steps, right? And I think that we've tried to, when we're made aware, certainly that there's a delay, identify what the issue is and work to move that forward. But if there are outstanding budgets that folks are aware of that they want to bring forward to our attention so that we can look into the specific issues, we're more than willing to do that.
So what we're trying to bring to you is more of a systemic issue. It's a problem within the system. If we need to do some research and collect names of individuals that this has happened to, we can, but it's just further prolonging the issue that we've already identified as being a problem. So I feel like we kind of did our homework, and we're asking if you could look into it and see if maybe central office could potentially consider, verify that this is what's happening, and then consider if additional staffing can be provided to help this situation, since it's one of the faster growing programs.
I would support Gail, what Gail is bringing to you. I had checked down here in the city with providers organizations, and the same issues were identified, that the delays at the central office were months long, over 6 months, and that was fairly common. So I don't know that there's one or two budgets we could bring to you. It seems like maybe you could check on on the timelines of budget approvals coming through central office, and you might be able to see the problem there.
Yeah, I think it's more the process in place, because it's just really, it's about communication. Certainly, ideally, all budgets would be submitted with no errors whatsoever. But if they are submitted with errors and they get through the different levels and they make it to central, and then central identifies the error, my understanding is that because they are so busy, that they just delete the budget. And all we're really asking for is that communication back down the line to say the budget didn't make it through. You need to find the error and resubmit it or something, because some of these month-long delays could be reduced or eliminated because they're not delays, they're budgets that were deleted and not going anywhere until we figure it out and then pull them back together and resubmit. So that's all we're asking, if you could reevaluate the process that's being used when an error is identified to see if there's some process change that could easily correct this for families across the state.
So Gail and Margaret, let us follow up on that specific detail.
Okay, thank you, Abiba.
Sure.
Okay. So that's pretty much it. The only other thing is not programmatic. It was, we had talked about instituting virtual regional meetings of the FSS advisory councils, which was something that we did in the past, the distant past, actually. That was very helpful for sharing information and sharing best practices and strategies for recruiting members and many things. And so Roger and I were going to talk about that offline, but we haven't yet done that. So I will follow up with Roger
Sure.
after this. this meeting, hopefully before the next one.
Yeah,
Okay.
just let me know when. I mean, I think one of the things we've seen as a positive in this last 14, 15 months is we have been able to expand access to certain types of, advocacy efforts and engagements because, folks who might not have been able to attend a meeting, travel to a meeting, they may be able to spare some time to virtually participate in things. So
right.
I think one of the things as we kind of come out of the crisis is thinking how we can leverage the positives or the positive learnings while also obviously from the
right. This way we're spared the expense too, which was definitely an obstacle.
Absolutely. We've seen in some of our advocacy organizations 500% increases in participation. I mean, really remarkable increases that just because it's more accessible.
Right. Excellent. Okay, so that completes that part of the agenda. And now I guess back to you, Roger, for the more on the 507 plan and the FMAP.
Absolutely, and I somewhat deliberately gave myself a very good segue into the processes we've been using to engage various stakeholders. So I think just to give a broad overview and then some specifics, mid we launched the public process for seeking information about our 507 plan, where 507 refers to the provision of the state mental hygiene law that looks for an annual plan to be composed by November 1. So we have been conducting a number of regional forums. I believe there's another one this evening, once again virtual because of the existence we currently have. We are also doing some focused meetings with various stakeholder groups, and we do have a particular focus of trying to meet with groups that represent traditionally underrepresented populations, so some very focused efforts around linguistic and ethnic minorities in particular who may not typically participate in some of our stakeholder engagement. And this is in service of a larger agency agenda around diversity, equity, and inclusion to make sure that we're reaching, as diverse a set of populations as we can. So we did launch that process with an announcement which had some framing questions, which were intended to try to get people thinking about some of the challenges and opportunities that the system faces these days. We also, at the regional forums, have been presenting a short PowerPoint, which once again tries to give some information about what is currently happening and some of the challenges and opportunities. One of, obviously, the biggest challenges we've all experienced over the last, it's now I think 15 months at this point, is COVID and how that has affected everyone, including individuals with intellectual and developmental disabilities and the service system. There has been an opportunity created out of this, which is in the American Rescue Plan, which passed Congress and was signed into law in mid-March. The creation of additional funds to support HCBS, home and community-based services in the states. And so that passed, as I said, in mid-March. In the budget, which was enacted at the end of March, there were appropriations, which is the authority to spend the money incorporated in the budget. And this applies not only to OPWDD services, but services for people with mental health needs, substance abuse, personal care, a variety of areas within the state where there is a home and community-based service authorized under federal Medicaid law. The way that program will work is that there is a 10% enhanced federal match against services rendered in this state fiscal year. So in other words, you look, we're about 2 months into the fiscal year in New York State, which begins April 1, ends March 31. You take, normally it is 50-50 state and federal. Now it becomes 60-40 with a requirement that the state use the additional funds to supplement, not supplant, existing state effort. So the upshot of this is the enacted budget has an appropriation to OPWDD of $740 million based upon some estimate of the potential extra earnings to the state because of this one-time enhanced federal match. What the actual number will be a product of what happens during the course of this year. So at the time the statute on a federal level was enacted, it was pretty broad other than this supplement, not supplant language. There wasn't a whole lot of detail or information about how a state might be able to use this money. The day after we issued the invitation for the public forums, CMS did issue guidance, and that both the all of this information is available on the OPWDD website as well. I should mention on the strategic planning website, and you can find the invitation we sent out for the public forums with the framing questions. You can find the guidance from the federal government around the uses of the funds. One of the things that the new guidance from CMS said is that every state must submit to them a plan. And originally they said that plan must be due to them by June 12th, which is 4 short days from today. They subsequently said that states could have another 30 days. So we are working in collaboration with the Department of Health, which is the agency, our various sister agencies, the mental health, substance abuse agencies in particular, to come up with the contents of that plan. And we are in turn being informed by the stakeholder engagement that we have initiated. The idea being the 507 plan is really looking at the 1, a 2, and a 5-year framework. What do we envision the future of the system to look like? And then, as the commissioner said at the outset, with these one-time funds, they're not going to be recurring monies. How might we, invest this opportunity to help build that future? So that's kind of the framework in which we're working. And let me pause there, having given kind of a broad and some maybe too specific framework, and see if there are questions, and then we can certainly get into the substance of the matter as well.
So talking about this 507, the share would be from 50-50 to 60-40. So Roger, are we talking about just the existing programs running, or an agency can think of another program and revamp the existing to a new program, and will that be funded and will be accepted into 507?
Yeah, so let's just to use the 507 plan is really the strategic plan. And so the enhanced FMAP is the additional monies. We are working on the plan. I will tell you, broadly speaking, there are, if you look at guidance, which I will hesitate to summarize because it's 21 pages from the federal government, that, there are things one can do, which would be, say, a one-time payment of some nature, right? So, you know, that would be money for a particular purpose. And, you know, I think the federal guidance has easily a dozen examples of those kinds of things. There are, and California has actually published its plan now, if anybody's curious. So, you know, as a potential understanding of what other state is looking at. There are possibilities, and some states are looking at temporary rate enhancements. So you take the existing thing that you're doing and you pay more for it, right? And then there's the possibility of spending on, some kind of transformational investment, the pilot program, et cetera. The key question in all of this is really sustainability, right? Because you can't, if you spend money on something where, you build a program, you build something and you don't have an understanding or an idea of how you're going to pay for it once the one-time money is gone, you're going to not accomplish very much. So that's the trick when you have like a very significant new investment fund. We've had an experience of this previously in the state. This is not dissimilar to the balancing incentive program, the BIP program of a few years ago. That I see some nods of the people who have the cameras on. So it's a similar concept, but you really want to worry about doing things that are sustainable, which is why we've linked in our minds the 507 planning, which is your strategic planning, to how you might want to use the FMAP monies. Because if we can envision what we want that future to look like, then you have a better idea of what a good use of the money is to get you to that future. Margaret, can I ask you? I don't know if we have other questions from the committee.
Does anybody else want to ask a question, give a comment, share an idea? I can't see the hands up. I don't know where they are. Josie, can you help?
Hi there, this is Gail. I'm just curious, Roger, if you anticipate once the plans are made on how to use this funding, if you anticipate planning committees at the state level involving parent volunteers to be a part of executing that plan partnership.
I'm going to take that as a recommendation, because I don't know that we've gotten that far just yet. I think that a lot will depend on. So first of all, the plans will also be subject to amendment. So part of our work is we may come up with more of a framework for a plan or pieces of a plan, and then we may say, well, we were going to try approach X, and we started doing that, and it didn't work as well as we had hoped. Let's pivot. I think that our anticipation is to make planning documents public. I don't know whether that'll be through the Department of Health as the single state Medicaid agency, or individual agency websites. I'm not sure how we'll do that, and probably get the feedback that way. I think that if we do get to a point where we're administering something around a grant program of some nature, what we will need to do is figure out what that looks like, and be careful to make sure that we're following conflict rules, and make sure that we're using a proper process. But we're really still very much at the what a structuring conversation. We haven't yet really gotten to the implementation question at this point.
Thank you for accepting my recommendation.
Other comments?
Josie, I see no hands up.
Okay, so Roger, I have a request. I have heard you do a very clear explanation of examples of ways that we could use the FMAP in tranches. Would you do that?
Sure. I'd be happy to. I guess one of the things we're still working out is how the funds will be received in the state, and then how that relates to the spending of those funds. So if it's earning 10% extra FMAP based upon effort, the first quarter of the state fiscal year closes June 30. Maybe you get some monies in July. At this point, the amount we've spent is zero, because the amount we have in our bank account is also zero. So there are possibilities if you're starting and thinking. We sometimes call them tranches, we sometimes call them buckets, but thinking about with first monies received, looking at quick opportunities to invest in the one-time type payments. Those would be the kinds of things that could happen most quickly to spend some money. And then as more money were to come into the state as a result of this, you would have potentially the time to do something that was more strategic and forward-looking. So setting up a grant program is not going to happen overnight. And you'll need to determine your criteria. You'll need to send out some kind of request for applications, and then receive those applications and then review them, all of which isn't going to happen instantaneously. So we really are trying to think about, are there tools and mechanisms that we can use to spend some of the money quickly, understanding certainly from a lot of the public forums so far and from a lot of conversations we're having, workforce being a primary concern throughout, whether talking to the provider community, individuals, family members, et cetera. Our workforce has definitely been impacted by COVID, and as well as larger economic trends in the state and pretty much everywhere in the country, actually. So if one were to think about where does one spend money most quickly, it would be, I think workforce is something that recommends it. And then you could be thinking about a second tranche or a second set of initiatives around more strategic, forward-looking investments to help, the system transformation, information technology, those kinds of investments that once again don't immediately sustain. How did I do, Margaret? Was it clearer or less clear than the last time
It was good.
Thank
But last time you gave some specific examples around workforce.
Oh, thanks. Yeah, so workforce, I think there's a couple of ideas that one could be thinking about, and we'd certainly welcome the FSS committee's, feedback on this. There's possibilities of a one-time type bonuses, right? That's something that could be spent. There's also possibilities of, wage increases. You do run into the question of sustainability when you talk about that kind of principle, right? If the wages are increased, then how do you plan to pay for that beyond the period of the availability of this money? And then there are, I think, a set of ideas we've been receiving from a number of quarters around retention bonuses, potentially incentivizing staff in various ways. Certainly seen some ideas around the relationship between bonus payments and vaccine, vaccinated staff. So there is a kind of a cluster of ideas. I don't want anybody to misunderstand that we've settled on any of these, but I'm just reporting sort of what we've been hearing from a number of our stakeholders. And then obviously, wage supports is another, cluster of ideas that, that folks have been suggesting in terms of the workforce. And in terms of workforce looking forward, there are, broader recruitment strategies, increasing the pipeline of workers, partnerships with, schools, high schools and these programs, a number of initiatives that folks have been working on sometimes for a long period of time. But once again, those would be more in the strategic investment category, I would think, than the one-time payment.
Right. I have a question for the members. Have many of you requested to speak at the forums? I know several of us have. Gail, I heard you. You were terrific. I haven't heard anybody else. Does anybody?
Margaret, Debbie.
Yeah.
I did
Hi, Deb.
just speak, but mine is not until tonight.
Okay, mine too.
Yeah. So we'll see each other tonight again. I'll be happy to see you.
Okay. And I think other people had planned to speak, did they?
Margaret, I signed up to speak. Our session was supposed to go from 3 to 6. It ended at 5. So therefore, they never got to me, which I don't quite understand because I thought there were only about 33 people on the call. So there should have been enough time for everybody. So I will be submitting mine in writing.
Right, good. Everyone should do that. Even if you spoke, you should still submit in writing, right, Roger?
Sure, but it was disappointing for whatever reason to have not had the full 3 hours as was scheduled.
Yeah.
Yeah, I don't know anything about that. What may have happened, so I can't speak to that. In terms of the, we have that planning at opwdd.ny.gov email address. That email address is also available on the planning website, and is in the PowerPoints that we're using and so on. So I'm hoping it's available and accessible to people, so folks understand. For every one of the forums, as well as some of the focus meetings we're having, we do have, we have a project for documenting, what happens there, so that we can, certainly understand what's been said. We are encouraging, and you're correct, Margaret, that folks who speak also submit the writing, just because, it's always best to have the most accurate, set of ideas that a person has, rather than what somebody heard somebody saying, right? And all of that is coming into one single central location where people are reviewing it, including actually myself. I've read every written comment that's come in so far, so I can confidently think that every single one of them, in one way or fashion, mentions the workforce. So it's so that's certainly helping inform where we think, for example, a useful investment of FMAP funds would go, since that seems to be predominant on every commentator's, minds.
Margaret, this is Ann. I did speak at Region 1 and submitted comments.
Good. Roger, what are the other themes that you're noticing in the testimony? Workforce is number 1.
Yeah, I mean, I sort of want to say workforce is number 1, 2, and 3. Actually, it's workforce. I think there are related themes that we're seeing, which is sort of service access themes. The ability to access the services that people need, but I don't know that that's actually a distinct question from workforce. It doesn't, I can't say that I have a full understanding of everything everybody said, but a lot of it comes back to, I may have an authorization for a community habilitation service. I may have, services that are authorized, but getting the supports I need from people is the barrier. So it's a barrier that is, in some ways not a product of state policy, right? It's not necessarily a product of the design of the waiver or any of the usual policy levers. It has to do with the relationship, the challenges in securing enough folks to work these jobs. I do say that something else we're sort of hearing, which is more in the forward piece is that as we try to think about the models of care looking forward, one of the questions is the workforce shortages something that demands that we think about models of care that are less workforce intensive, right? In what ways can technology or other, design, more flexible support models, et cetera, help deal with the somewhat chronic shortages of available workers. So that's the question we're trying to kind of puzzle out. That's not an overnight question, but when we think about, investments as well as the 507 planning process, that's certainly, I think, a very interesting question. I guess I welcome the FSS committee's, reflections on that, and including whether it's not an interesting question or the wrong question to be asking, but it does seem like that's we've been dealing with a workforce shortage or crisis for some period of time, and it doesn't seem to be abating. One has to think, are there other ways of approaching the supports and services people need?
Hi, Margaret. This is Crystal Bossler. I just want to let you know that I spoke for the Region 1 as well.
Oh, great, Crystal. Thank you.
Thanks.
Thank you.
Yeah, hi, Margaret. I speak as well. It's Chris.
Hi, Chris. Great.
Margaret, this is Christy. I spoke for Region 2.
Oh, hi, Christy. Oh, great. Terrific. So a lot of us have been speaking. So, Roger, I have another question for you. Oh, she just left me. Oh, yeah. People who are hard to serve because their needs are, well, basically, their needs are staff intensive. People who have complex medical needs or complex behavioral needs. There's always been identified that the services available to those people are fall short. Are you hearing testimony about that? Because of underfunding. I think we lost Roger.
Yeah, no, I was talking into the muted mic again. That's my own defect. I can't say that I have necessarily. I can't say that hasn't happened. I've read, I said, all of the written testimony, which seems to be more focused on workforce issues. I do think that we do have some things in the works on that, really independent of or maybe it's related to the 507 planning, but it's one of the things, and I think the biggest thing we're trying to accomplish in this calendar year is reform to our rate setting methodology. So what we believe is that the inability to serve those higher needs individuals, and those are typically individuals who do require that 24/7 certified capacity, because of, if we're defining them as individuals who have those higher support needs, is our rate setting methodology does not appropriately incentivize providers to take on what would be a more resource intensive task. So what we are doing from a rate setting perspective, and we've been working very hard with there's a provider work group, as well as obviously the state's actuaries, Deloitte, our partners in policymaking on rate setting, the Department of Health, is looking at moving rate setting away from the current cost-based methodology to a regional fee with an acuity adjustment.
I'm sorry, you went out. You faded out.
Sorry. So we are looking to move. So the cost-based methodology, which currently looks at a provider's historical costs and then makes the provider's rates based upon that cost. And that's not linked in any necessary way to the acuity of the individuals served. So the problem as we see it is an individual may be coming into the system. Let's suppose they're, coming, a young person who's aging into, adult services. And a provider can see that this individual would require, a higher level of support. And so would be, can calculate what that might cost. And they look at their rate. They say, well, I'm not compensated at that level to serve that individual.
Right.
Our current cost-based rate setting methodology is about 2.5 years out of date at all times because it looks back at historic costs. So the provider would be in a position where they would be, in essence, eating that cost over a period of 2 to 3 years and hoping that the cost-based rate setting sort of catches up. The thinking is if we had regional fees with an acuity adjustment, there is no such thing as real-time rate setting, really. I mean, there's always some delay, if I understand it. But the idea would be a provider would know what their regional rate is because it would be set. And then if they're taking on, higher needs clients, they would see that relative acuity score go up. The downside, of course, is if you're a provider who's taking on less needy individuals, you would see your acuity score, go down. So it's a rate methodology that we think will be fairer, more equitable, will serve those higher needs individuals, but we fully anticipate will be with some controversy because there may be some providers who see, their rates decline because of the nature of the population they're serving. That's the fiscal strategy to address the problem that you're mentioning. We're hoping to have that public comment. We're hoping to have that ready by the fall.
Okay, thank you. That was very clear. Other questions?
Hi, this is Gail. Again, I'm just wondering if there's something that families can do to help with advocacy around rates and things that impact staff wages. As I said last week, and I'm sure you've heard a million times, like you said, the staff who's been around forever, for a very long time. We are seeing a response to sign-on bonuses and some really great responses to, premium rates of pay. And it feels like we're kind of working with our own little private petri dish, and we're able to kind of see those higher rates are driving applications and new hires up, which kind of says this is really, it is a staffing crisis. It really is around rate of pay because those rates haven't raised like our minimum wage has, et cetera. So I'm just wondering, I know that OPWDD does not have all the power in the world to wave a wand and make that be what we all think it should be. And I do recognize that. And as partners with OPWDD and family members that have loved ones in the system, I'm just wondering, honestly, what can we do to help make a change on that? Because we can have all the most incredible programs in the world, but if we don't have staff to run them, it doesn't matter. And one-time money is great, but if we don't have the staff 2 years down the road, it's not going to matter. So I really want to know how we can help make this even better for the people that we love and care about and the staff that's working with them.
No, and I think there's very much of a shared goal here, right? Which is that the foundation of our system are the people providing the care, and so they need to be supported. I think there's a couple of ways which we're looking to partner. One, the planning process we're going through is very deliberate. It's identify priorities, right? It doesn't mean if you identify priorities, it doesn't mean you can do all of the things, right? Because you mentioned power. The other thing that's not unlimited is money, right? So that's that becomes the timing. Will be that I think the statute says we're supposed to have a 507 plan by November 1, which, corresponds, and I think deliberately from a legislative perspective, to the time frame for, budget making, annual exercise around, priority making, which is a budget. So, our hope is to be able to be quite clear in reflecting back both stakeholder input as well as our own internal analysis as to, priorities, right? So, there may be things that are priorities, but some things are more important to do first, right? And what we're hearing is workforce. Okay, so that would mean maybe some other places where you might otherwise say, well, that would be a priority if I didn't have this crisis. You say, well, that's not going to be the thing that I'm going to say is the priority right now. Just household budget to a $9 billion organization budget. It's the same question. And so I think that that process is really important. Understanding our plan would be early to mid-September. We would be publishing a draft 507 plan. It's subject to a public hearing, as well as the Developmental Disabilities Advisory Council. So there'll be an opportunity for people to say, hey, you did a really good job in parts 1, 2, and 4, but part 3, we think you did sort of a lousy job. Here's how you can do it better, right? However people think we did. And then if we can achieve some rough consensus, and I say rough because there will be dissenters and different groups that will have different opinions, obviously, then we can say, okay, this is where the field lies, this is where the agency lies, these are where the priorities lie. That would hopefully inform the ability to form, a budget proposal for the legislature. And then there's a review process, including the advocacy, that you all engage in to, to push it in a direction you feel that is more, supportive of the goals. So, I mean, that's the process, right? And I think there's a lot of opportunities for advocates to engage with that process, including, telling us where we're pointing in the wrong direction and helping steer us in a better direction.
This is Ted. I just wanted to respond to what Gail had said, and encourage all of the advocacy to be fairly precise in its use of language. So I heard you talk about rates, and I heard you talk about wages, and those are in the eyes of OPWDD very different issues. And if the ask is for rates, we would interpret that to mean rates for providers. And to the extent that that would address DSP's wages, it would only address those DSPs who are supported or are employed in agencies. It wouldn't address all those DSPs that are working in non-provider-based service systems or models. So as you think of your advocacy, if the focus is on the workforce, the ask could be about wages, salaries, compensation, because that would speak to the entire workforce, both of agency-directed and non-agency directed staff, as opposed to rates, which is going to take us in a different direction as we start looking at your input. So it's just going to be precise about how you advocate around this issue.
Thank you for that, Commissioner. I appreciate it.
Thanks.
Other comments?
Yes, this is Crystal Bossler from Region 1. I didn't think to mention this in our forum, but I do think this point is important to bring up, that there appears to be a backlog in the IRIS system. We're seeing a lot of kids that need residential placements in IRIS that are taken up by older children that should have aged out into adult IRIS, but there isn't any placements available. Parents are needing an IRA for their child due to the safety of the other family members in their home. All of the other in-home services and supports have been exhausted, and it is just plain dangerous for the family for the child to stay there. We need to provide more behavioral family supports before it creates this crisis. So this is something that could be proactively planned, and we need to be able to have appropriate systems in place for this, because having adults in children's systems because there's no place to put them is creating this backlog. And there's huge safety issues for families, and families want to be able to keep their children at home. And I think we need to start providing more of these services and providing behavioral supports for these families before this ever creates an issue. But we also need to address and look at the fact that there is a backlog in the system. Thank you.
Thanks. And Crystal, just to be clear, are we talking about certified residential? Are we talking about the CRP projects, or are we talking about just IRAs?
IRAs.
Right.
Yeah, IRAs that I'm familiar with, but I'm not sure for the other.
So I was going to add, you mentioned kind of a outcome around a lack of housing for children, but you also identified a cause which you attribute to be a lack of access to behavioral supports and services. I think one of the really useful for the family support councils to tell us is where the gaps are and how you're addressing those needs. So, you know, we've done this before. You're putting resources into behavioral services. You're putting resources into some case management supports. You're putting resources into adaptive equipment, technology, and things of that type. I mean, what that tells me is that our system isn't working in those areas, and there is a need for additional support. I would really welcome input from the family support councils around what you are seeing at the grassroots level, at the individual level, and how that could inform us as a system about where investments need to be made. Because I know you're identifying those problems. I know you're supporting interventions to address them. And behavioral services is a great example. You know, we don't have a big investment in behavioral services and supports, particularly in homes. You're funding services in those settings. Tell us about that and tell us why, because you're the canary in the coal mine. You're seeing things that we don't see because you're operating at much closer level to families. And that insight would be really helpful to us as we look at both the 507 and the FMAP discussions.
I'd like to comment on that. So in terms of the behavioral services in family support, you had a desire to convert those to waiver. And I believe in doing so, lost some of the flexibility that we had in the family support funded behavioral services, so that maybe not as many families are eligible now as would have been. Under maybe what we need is a balance of the waiver behavior supports and the looser family supports.
We haven't done behavioral supports in the waiver. I mean, in general, we've liberalized access to services through the telemodalities that we've been offering. So we haven't touched behavioral services.
Well, except for the intensive behavioral service supports?
It's still in the waiver. Nothing's changed.
No, but it wasn't. And we were concerned that waiverizing the intensive behavioral supports was going to establish more restrictive requirements, eligibility requirements, and program.
Intensive behavioral services is a waiver service. It's currently in our toolbox.
Right.
But what you're telling us is that it doesn't work because you're funding behavioral providers using family support dollars, whether they're matched or unmatched, waivered or unwaivered. That's not the issue. Why are you doing that? You're doing it because our system isn't working. Tell us why our system doesn't work. Help us understand how we can make it better. Help us understand what we can learn from family support councils who are making a service available and making it work. What is it that you do that's better than what we do? That's what I'm saying is you're doing things to address needs that we aren't responding to. Tell us what those needs are, how we could better address them. Help us learn from you, because you've got great insight into things that we fail at, and you're investing to overcome those failures. So those kinds of things, I think the family support councils are in a very unique position to help us with, in a better position than pretty much anyone. And certainly those are things I want to hear about in both the 507 and FMAP discussions.
Can I sorry.
Yeah, go ahead, Roger. I just wanted to follow up with one more thing, if I may.
Please.
Is that okay, Roger?
Go right ahead, please.
Where you go? Okay. So to address this, we need a tool. We need data. At some point a few years ago, I don't remember when, you did a study of family support services, utilization of different types of family support services. And I don't think it was widely shared. We did talk about it a little bit with Abiba at one point, but that's what we need. We need that kind of data on the utilization of family support services. That will help us a lot.
I don't know what to say, because we did talk about this, and my recollection is correct, somewhere around 4, 5, 6% of family dollars were spent on behavioral services. So I'm asking, why is that the case? What is the need that you're addressing? And is that a need that we could address with our current toolkit of behavioral services that are already in the waiver? And I don't know that that's a data question, as more of a qualitative question. What is it that we're not doing that you have to step up and do? Whether it's behavioral services or other services.
Let me, Commissioner, if I could just flip your words around, because I think I know what you're getting at. One of the things that is implicit in a 507 planning process is a gap analysis. Where are there gaps in the current service system that strategy or investment would help cure? The FSS program over time could be constructed as a gap analysis, right? Where are there gaps where this filler is being used, and how does that inform how we might think about the program moving forward? Just another way of saying the same thing, maybe.
Hey there, this is Gail. I hope I'm not interrupting anybody. I just wanted to slide in. Commissioner Kastner, when you first started, you and I spent some time talking about this topic, and we talked about the rate initially and did some back of the envelope quick math to kind of address the rate versus the credentials that we are looking to have for the staff that work in these positions. And that was one of the first barriers that we identified with IBS. But I just want to say, I'm not just a parent, but I also do work with some incredibly intelligent, talented individuals that provide this support and service, and I've seen some great work that they've been able to provide. And I just want to extend an offer at any point in time. Anybody on your team would like to sit down and talk a little bit more about qualitative data about how services in family support seem to fill this gap better than IBS. That invitation is open 24/7. I'd love to spend more time sharing what we've learned through this service, why it is effective, why it does seem to help families, and why families seem to not be going on the route of IBS, nor our providers. So I just wanted to put that out there. I'm more than happy to talk about the flexibilities that the program provides currently and why it's popular and useful and efficient. So please keep that in mind. The invitation is open.
Well, but I would also say we have an invitation, which is to participate in both of these planning processes. Tell us now, just send it to us, because we don't have feedback from the family support councils on what the value of their services are. I've sat at all three of the current public forums. We have two more, one tonight, one tomorrow night. No one has said, this is what family support councils do and why we do it. And the opportunity is there right now, particularly around services that are in the waiver. You know, what is it that we fail to do in our waiver? How can, you know, what the work of the Family Support Councils be viewed as the gap analysis and the intervention to address those needs? So really, tell us now, this is the forum in which we've got to have this discussion.
Okay, I'm happy to do so. Like right now, right this moment, or you want to
send us some written, have the Family Support Council send us some written testimony about what it is that the Family Support Councils do so well and why. Help us understand help us learn from what you're doing.
Sure.
Great stuff. Tell us about it. Help us understand how we could do things better by learning from what you're currently doing. No one else is going to say that for you, for the Family Support Councils in general. No one is going to speak on your behalf. Lots of folks are going to talk about rates for various types of providers, DSPs and their wages or salaries, but nobody other than Family Support Councils are going to speak up for Family Support Councils. So you guys need to advocate for what you do. And it's great work, and we can learn from it, and it would help everyone. So send us some written stuff. Thanks.
Okay.
Okay, I'll stop. I know we're going to move on to other things, so.
Which we have more than enough time for, I believe. So if people have additional thoughts on this, this is the time.
Hi, Margaret. My hand's been up for more than 20 minutes.
I can't see hands, so if no one's telling me,
okay,
you have to kind of break in, because
okay,
like you just did, yeah.
That's not what I'd like to do. Okay, Commissioner Roger, I want to say this. I've been on my Family Support Council for many years. I've also been in New York City. We have DD Council. I have seen the professionals and even OPWDD give us lip service about listening to what we say. You say you hear us. We put it in writing, and this because it's not my first 507 testifying or anything. But then when we give you and tell you what really is happening, you don't always take it through. You don't always hear us running. You say it, but you're not receptive. And it's painful. We don't always want to hear, but you see, the one thing, the agencies, they say, yeah, the only time they want us is when it comes time for advocacy funding. But the thing is, we all, us parents and the councils, we live with our children 24/7. And even if my child goes into a residence, that doesn't mean he's in my heart and mind all the time. And when we see things that are done differently, or there's a problem, we try to bring it up. We're labeled as troublemakers, big mouths. And the other thing I'm really very concerned about is that when we give you ways to save money, you tell us no. But also what frustrates me is that there's no consistent, like, tell us don't talk about rates, but then talk about wages. And you know what, we don't even have the time to get the wrong information of what type of job the person coming into my home is supposed to do with my child or not to do. And then, I mean, we get conflicting messages. So I'd like it to be more consistent. And because us parents are inspired of that, we give the right information. We tell you what we need, and then we ignore the total bother. So it's frustrating.
Well, Deborah, I'm sorry. It's been so frustrating for you. I know that you've been advocating. You're going to get another shot at me tonight. I won't be able to respond, but I'm looking forward to hearing what you have to say. I will say that we do hear what people say. We often can act on what people say because we're part of a bigger system within state government. What we're hearing now around both the FMAP and 507 is about direct professional wages, that the wages are too low to qualified and available workforce. And probably 85–90% of families have brought that up. The second, and I would say much less frequently raised issues are around sustainability, whether those are around self-direction or residential service access. Those are also there, but it's DSP services and access to qualified workforce are the 85% of what families are saying. We have.
I understand that, Commissioner, but what I'm stating is that when now I know that the governor is your boss. I do understand the political system. But if you want us parents to be able to advocate better, we need the right, correct information or the tools, the labels. Like a respite worker does one thing, but ResPap or ComHap does something different. Samples like that. And then when that helps us to advocate even better. Because then I know what I'm saying. Because then I don't want to be made to like a fool. Because I'm not. I'm a parent who's very passionate and decides to advocate for my own job. Parents are my counsel. I fight for any funding to help with OPWDD because I don't want to see anybody have problems. So I'm sorry for the input. I've heard this before, Commissioner, and I want to make sure that I understand political. I do understand the political system more better than a lot of times I'm giving credit.
Well, thanks again, and I'll see you tonight.
See you tonight.
This is Ann. I have a comment, if I can now. I was wondering if you are looking across systems to see what other systems are using for different kinds of supports and systems. One thing I want to mention, I was on a suicide prevention committee this morning for our county, and they were talking about getting funding to use iPads with first responders when there's crisis situations and how to do a diversion so they don't automatically ship someone to the hospital. But I'm thinking about, because I asked about people with IDD, are they being trained and, supporting them too, maybe to help them support and have linkages other than sending to the hospital. That's one thing. And the other thing I heard through a survey message or survey that was done was looking at a mall that is dying in our area and utilizing it for like a multi-purpose opportunities for the community that would provide services and respite. It could be OT, that anybody could come for OT in that building. And it sounds like kind of an exciting idea if it can be materialized, something of that nature.
So Margaret, we've got until 2 o'clock and I don't want to cut Chris Pallega off. I want to make sure there's enough time in the agenda for him.
Yeah. Anybody else before we leave this subject?
I would just add that we as what Commissioner Dr. Kastner has said, what my understanding is, like, he wants recommendations from family support advisory councils at local level to know what the needs are and how it can be addressed, especially behavior management. So I would really definitely be going to discuss it with my members and bring it up to them. But basically, I would really at this point recommend that there should be training for staff who are interested to work with individuals who have behavior issues, so that they become an asset to not only just to their agency but to OPWDD as also, and they can move up in their rate wise, in their qualification, and that's how in medical also we do that. Extra training would make them an asset.
Thank you.
Okay.
Hello, this is Mary Fasano. I would just like to say that, Commissioner, you say you want to hear from us. But if you go back to the beginning of our meeting, Margaret outlined our areas of concern. And I think we probably have had the same areas of concern for the last 4 meetings. And we've probably gotten the same response. We'll get back to you. We'll get back to you. So I think in fairness, we'd like more than we'll get back to you. We'd like some answers.
Well, I think are having these dialogues. Let me just make sure, so that we can have the kind of discussion and give you the answers that you're looking for. I can't speak to specific concerns that you've raised, but in general, that's what we're trying to do in meeting with you and fostering dialogue and actually encouraging the family support councils to give us feedback on both the 507 planning and the planning around the enhanced FMAP. We can't address every concern that family support councils have, but we certainly want to hear what they are and look for opportunities to address them.
May I add to what Mary just said? Commissioner, this is Kathy Nowak. On June 9th, Margaret submitted a follow-up to the March meeting. And it was just a simple 8 points. 8, and we've been asking forever about getting meeting minutes. If we come find out today that we won't have meeting minutes, why didn't anybody just give us the time and respond? You knew it, so why did you wait 3 months? As far as the reimbursement guidelines, this has been on our agenda. I'm gonna say Eva was not even pregnant, so I don't know how old your child is now, but it's been that many years. And we keep getting, we're working on it, we're working on it. We don't seem to get any answers. And honestly, it's so upsetting to me because it makes me feel, I'm not speaking for the committee, devalued. We just keep having meetings and speaking about things. You know, when we talked about the number one concern about the family support meeting, and I believe, and I was in and out, it was hard to get in today. The response was we didn't, you know, we had COVID and whatever. You know, Evie talked about this when she was the member for Sunmount for years, that they had a pot of money up there and they couldn't put the RFP out. And she never got an answer why, kept asking. And it makes us look bad to our local councils, because I'm sure many new members felt this way, that their statewide rep was not doing a decent job. It was a bad reflection on us. So I think we really need to look at how you do value our committee. And if we keep asking for things and not getting responses, then what's the value of the committee?
Well, I appreciate your sentiment. We received a detailed list of questions and concerns from Margaret on your behalf. And we walked through everything on that list during today's meeting. We also talked about transcripts versus minutes. We will be able to make available a complete transcript of today's meeting for everyone to be able to look at. They know what was discussed. I mean, I think that's responsive to the issue of how these conversations are represented to the larger audience.
Okay, I don't want to have an argument about it. And this is, I'm being very brave right now with 163 people on this call. But
196, but don't worry about it. You know, you're doing great.
Yeah. We're 8 concerns as a follow-up to the March meeting. That doesn't mean we should be waiting 3 months later. It would have been simple for someone to say, oh, we want to give information to direct to the front door, each council. Why didn't somebody come back and tell us to start working on it? Why are you telling us 3 months later? It's crazy. I mean, we sit there until the next meeting, and now we're going to start working on it. It's very hard to work when it's not a two-way conversation. Yes, you absolutely responded today, but you didn't respond in what I would call a timely manner. Maybe there's a disagreement on what a timely manner is.
No, I'll take your word for it that the regional family support councils didn't receive that specific instruction. But I don't really want to go into it in terms of, you know, who said what and where and when and start to look for blame. At this point, we have an agreement that the regional family support councils need to send the information they have to our regional offices so that can be incorporated into the mechanisms for disseminating it to the general public through each region. And I think we have an agreement on that, right? It's going to come from the regions to the regions.
Okay.
And that's progress. It's not fast. It takes time and it seems painfully slow sometimes, but we are trying to respond to the questions and the issues that are raised. We are trying to address the concerns. I'm sorry that it's frustrating for you and for others too.
I would just add that when there are concerns and we want to pinpoint certain issues, the best way to reach out is the best communication we have between ourselves as a council with the DDRO. And the DDRO moves it forward. If there's no answer, no response from OPWDD central office, then we can document in writing and let the hierarchies know about it. But coming up after 3 months and addressing concerns, it makes me very uncomfortable. Thank you.
One other thought I thought too is maybe we should go back to having those meetings that we used to have, the regional meetings that Mark talked about, also to help us also have more input with OPWDD. I mean the DDROs rather.
So Margaret, the meeting is yours.
Oh dear, I'm so sorry. I was talking all this time.
Yeah.
But I thought I was still unmuted. No, I said thank you to Kathy, thank you to Aaliyah. We should turn now to Chris, who's been waiting patiently, and give Chris his opportunity to speak about advocacy.
Thanks so much, Margaret. Good afternoon, everyone. I'm Chris Palega, and I represent Region 1's Monroe County FSS Advisory Council. I've been self-employed for most of my life. Like many of my peers, working 80-hour weeks for months on end became second nature. My wife is a clinical psychologist. She has a deep and intimate understanding of our daughter's challenges. I'm constantly impressed by her fortitude, and I am so grateful for the bounty of resources our family has been blessed with. Even with all these advantages, raising and keeping our developmentally disabled daughter safe and living with us at home has been exponentially more challenging than anything I've ever undertaken. There are thousands of New York State families supporting their developmentally disabled loved ones at home whose challenges are far greater than ours. I'm continually humbled by the strength and tenacity they demonstrate every day. For many of these families, family support services are critical for keeping their challenges manageable and their families intact. Many of us were impressed by the recent advocacy efforts of families wanting to spend time with loved ones supported in residential settings during COVID-19. Many families participated in this effort. They were well prepared, well organized, vocal, visible, and committed, and they were successful. Commissioner Kastner, I recall you describing this effort as the type of advocacy that can assist you in moving toward our common goals. Because I believe the best solutions are achieved when we're all working together, I want to start by thanking you for recognizing these families and the contributions they're making. I also want to share my observation on advocacy within the FSS community. As I said, families supporting developmentally disabled loved ones at home are struggling. We can all relate to this through our own personal experiences. It just seems unrealistic to me to think these families could mount a broad, sustained, real-world-based advocacy campaign under current conditions. Still, the need for advocacy remains. Seeing social media as an important advocacy channel for FSS community, Committee Member Vossler and I, along with a small group of stakeholders, are working on a relaunch of the FSS Saves Families social media platforms. We are currently operational on Facebook and Twitter and are hoping to bring the Instagram account online in the near future. Our goal is to build an integrated social media presence focused on families who are supporting developmentally disabled loved ones at home and the FSS issues that are important to them. We'll rely on support from the FSS community and hope to discover opportunities to join with OPWDD as we work together toward our common goal, putting people first. I'll leave you with this. I've been saying for some time now that families are foundational to the success of OPWDD. Over the course of my time, my experiences have certainly reinforced this belief. Envisioning the stress that any acceleration in the need for residential placements would have on an already distressed system of care convinces me that the weight of our developmentally disabled brothers and sisters is being carried on the backs of some of our most challenged and heroic families. Commissioner, if you are not there yet, I hope that you will come to believe, as I and my local advisory council do, that families are indeed foundational to the success of OPWDD. Thank you so much.
Thank you.
Any comments? Any questions for Chris? Hey.
I'm Margaret. Chris, this is Debbie from Brooklyn. I just want to say I understood everything you said, and you know everything what you're saying. So many families in the same position, and I'm really glad you spoke about it. Thank you.
Thank you, Debbie. Appreciate it.
No problem.
Margaret, this is Roger. If I could just get a quick word in.
Of course.
We got one note, and it may be reflective of some others. Somebody who is an attendee and was reflecting this is the first time that they knew about this meeting, and they were really excited that they were able to observe and wondering how to become more involved with advocacy and engagement. And so the email that I got did not indicate where that person is located in this great state of New York. But I would say that if they know who the Developmental Disabilities Regional Office is, to contact that office and learn about the local FSS committee. I think that connects the beginning and the end of this agenda very, very well. And I mentioned that more broadly rather than by email back to the particular person who put in the note, because there may be others who are involved in these groups only for the first time and wondering, how do I become involved, more engaged in advocacy? So I just wanted to throw that out there as a little advertisement for the FSS councils across the state.
Yes. Terrific. Thank you very much. That is a good conclusion. Our next meeting, according to my notes, is September 28th. Is there a reason that we're doing this 12 to 2? It's not a great time. 10 to 12, 11 to 1, 2 to 4. 12 to 2 is kind of.
Why don't we take that offline? We can always find, I mean, I'm sure it was because it conflicted with something else, but we can figure out a better time between now and 3 months from now.
Okay, that's good. And then Josie, if you would be so kind as to send us a notification when the transliteration document is available, that would be great. And the sooner the better, especially because it's very hard to take notes and listen and talk and respond and everything at the same time, especially when you're getting a whole bunch of data, which the commissioner gave us. Thank you for your report, Commissioner. It was very helpful. But I'm sure there are holes in my notes, and I'm sure there are holes in other people's notes too, because it went by pretty quickly. So thank you everyone for attending. And let us know if you have concerns or other things that you want to address, and we will follow up on a couple of issues that that were raised with the local councils. Okay. Thank you.
Thanks. Bye.
Thank you.
Bye.
Thanks, everyone.
Bye.
Thank you very much. Thank you.